Hello, my name is Tiffany Parker, and I'm going to be talking to you about preoperative and postoperative care. Preoperative care. The preoperative phase begins once a person is informed that they need to have surgery or procedure and ends once they enter the operating room. The physician goes over the risks and benefits with either the patient and/or family, friend, or power of attorney. The patient or family or power of attorney will sign an informed consent. And that is when a physician goes over the risks and benefits of the procedure and the patient and or family do still want the procedure to be done. As a nursing assistant certified, you do not explain a procedure, risks, benefits, etc., or have a patient sign a consent. If a patient has additional questions, let the nurse know. Keep in mind that everyone responds differently to having a surgery or procedure, which could include fear, anger, denial, sadness, or excitement. Patients typically are not allowed to eat 8 hours prior to having a procedure or surgery, and that's also known as NPO, nothing by mouth. The reason is to have the stomach empty to prevent food from coming up during surgery, which could cause choking, aspiration, and death. Aspiration can lead to pneumonia. Patient has increased chances of vomiting when the anesthesia is wearing off. Patient teaching is sometimes started preoperatively and continued postoperatively. During the preoperative time, the postoperative phase after surgery is discussed so patient knows what to expect. Be aware that patient may have some stressors, including lost income, length of recovery, death during surgery, pain, and if a physician will make a mistake. Patients need to bathe or use special wipes or solution, could be called chlorhexidine or HiPoCleanse, prior to surgery, which contain antimicrobials to decrease the chance of infection. And that is typically used on a specific area and at times can be used throughout the body. Things that may need to be removed prior to surgery would include makeup, nail polish, contact lens, hearing aids, dentures, wigs, jewelry, and prosthetic devices. Patients in preoperative should wear clothes that are loose and comfortable, keeping postoperative in mind for mobility. Postoperative care. Postoperative care is when a patient leaves for surgery and is taken to a post-anesthesia care unit, also known as PACU or a recovery unit. In PACU, that staff will make sure that patient is recovering without complications from surgery or anesthesia. Once patient is cognitively back to baseline and vitals are stable, patient can either go home or transfer to an appropriate unit of care. If a patient is not recovering as expected, the patient may stay in the PACU for an extended period of time or go to a higher level of care. If a patient is in an outpatient surgery center and they are not recovering as expected, they could potentially be transferred to the hospital. If a patient was scheduled for a surgery or a procedure at the hospital and was expected to go home and they are not recovering appropriately, they may send them to a medical surgical unit and keep that patient overnight just to monitor them. When a patient is at a facility prior to going to surgery and coming back to the unit, it's important to be mindful to change their bedding out so they have new bedding when they come back from the surgery. Other important things to keep in mind is having an emesis basin, oxygen with oxygen setup, and to have tools for checking vital signs when they come back from surgery. The frequency of vital signs depends on the facility that you are working for. Vital signs are often checked pretty frequently and right after surgery, and then it does taper off. Often you can see vital signs checked every 15 minutes for the first hour, every 30 minutes for hour number 2 and 3, and then every 2 hours for a couple of hours, and then moves to every 4 hours. Again, you don't need to write down and keep it real specific because that can vary per facility. It's important to report any changes in the patient or vital signs to the nurse. And it's important to be aware of the patient's baseline. Surgery on extremities, including arms or legs, may need to be elevated after surgery to help prevent the patient from getting swollen or decrease the swelling and/or pain. Post-operatively, patients are at an increased risk of having complications, including airway, breathing, circulation, and risk for infection. Hygiene is very important to prevent infection. Report any concerns or abnormalities to the nurse. Types of anesthesia. General anesthesia is when a patient is given medication and they are unconscious during a surgery or procedure. An example would be a hip surgery. Regional anesthesia is when a patient is conscious throughout the procedure. They have a loss of sensation in part of their body, but not all of their body. They may experience being paralyzed or have weakness of a body part until the anesthesia wears off. An example would be a C-section for a delivery of a baby. Local anesthesia is when there's a loss of sensation to a small part of the body and the patient is conscious. An example would be if you are getting dental work. Additional post-operative concerns. When a patient comes back from a surgery or a procedure, they may be at increased pain. And due to that increased pain, they may not want to move much, which will cause them to be immobile or can cause them to be immobile. Due to that, they have increased chances of developing skin breakdown. To avoid that, we want to ensure that patients are repositioned every 2 hours, and that can be positioning them with pillows and on their side, and that can be bridging them, and these will be examples that we will show you in class. When a patient is alert enough and is not nauseous anymore, it's important to check with the nurse that the patient can in fact eat or drink. After patients have anesthesia, it can take them a little while to be able to have the ability to swallow safely. Patients may also have difficulty voiding or urinating after surgery, so it's important to check that the patients have emptied their bladder and that they are voiding frequently. Patients may need to have what's called a bladder scan, where a nursing assistant can check to see if there is urine in their bladder, and depending on how much, talking with the nurse would converse with the physician. Patient may need to have a Foley catheter placed, which would drain the urine from the bladder. Immobility, pain medications, decreased appetite, decreased intake may all increase the chance of constipation. So it is important to inform the nurse if the patient is complaining of constipation or that they have not had a bowel movement. It can become severe if it's not treated properly or quickly. When ambulating a patient for the first time, it is important that the patient sit at the side of the bed first. The patient may be dizzy, so we want to give them time. We don't want to be in a rush. And then helping them with standing up slowly. If they have denied any dizziness standing up, you want to help with walking them with a gait belt to the destination, whether that being to the bedside commode or to the bathroom. You want to take small increases of distance, and then maybe at one point they'll be walking around a nursing unit. You do want to check before the person gets up for the first time, their first ambulation after surgery or procedure. Check their vital signs while they're lying in bed, and then when they stand up, you want to make sure that both that they are not lightheaded and seeing stars, and or that their blood pressure has not dropped too much. If their vital signs have changed, you would want them to sit back at the side of the bed or get them back in bed and let the nurse know, as this could be an increased chance for the patient to get lightheadedness when they continue to stand up and walk around, and or possibly faint and cause further complications.